So just following on the course description, we also have a marvelous team of colleagues who work with us on the International Health and Tropical Medicine course, who have areas of research and activity that I wanted to take the opportunity to highlight here. In general, we cover quite a broad range of activities, from building local research capacity to informing health policies. We work on reproductive, maternal, newborn, child, and adolescent health projects, as well as health and entrepreneurship activities. We also have some computational science expertise on the course, and so we're developing more projects in that area. Global health ethics and governance, you'll hear more about from Cesar Aturi and his group. And we have policy and research practice, which is Alice Norton, who's with the PSI but affiliated with us. And we have global health diplomacy, which covers global health diplomacy, but as well as EDIA, and that's with Roger Nascimento. We're just going to go over a few of these in a bit more detail. And if I could ask my colleagues to come down.
Good morning. I'm Karim Nasron, and I am actually an alumnus of the first cohort of IHTM 10 years ago. Right now, I'm a teaching and research associate in the course, but I'm also the lead of the life course submodule. I just want to give you a little flavor of some of the work we're doing in research, but that's also closely linked to the placements we're offering to our students in the last term. So the first one I would like to talk about is the Seychelles capacity building work that we're doing since a couple of years. All the work we do, the collaborations, are on invitation of people, not us going in. And we were invited by particularly the Ministry of Health of Seychelles to come in and work with their program managers and their teams to build research capacity. Because all these program managers do collect lots and lots of data, put them in reports, feed them up to layers higher up, but actually they have a lot of questions and they can't do anything with it. And very often they have to invite foreign institutions to come and answer their questions. So we wanted to support them to use local data to answer relevant health questions, to inform health policies, but also the questions they think are important because they know their context. To develop their research skills of the project managers, but also their teams, support the quality of care team, and use qualitative healthcare management finance tools, get a better sense of research ethics and data governance. And last year, we started off with a one-week workshop where we had all the program managers together and actually worked through the research cycle, bringing them together, thinking about questions they had, data they had, how to find existing evidence, formulate research questions, thinking about the right tools to answer these questions. And it was an initial kind of week, and then we left it kind of there. So in about a year ago, we got a question from the team of the family health programs. We actually took on board what you told us, and we want to do qualitative research because for a lot of them, qualitative research was very new. And they actually were planning to implement and integrate a comprehensive sexuality education in the school curriculum in Seychelles. But it's quite a contentious topic for a lot of people. Seychelles culture can be quite traditional, and they really wanted to get a better view on the existing situation, the views of important stakeholders, and they said, can you help us? So they started with developing a proposal, and step by step, bi-weekly or bi-weekly team calls, we kind of supported them and guided them through those initial phases in planning, thinking about methodology, recruitment, who will be the participants, which stakeholders are you talking about? So the aim was to understand the perspectives of the stakeholders, the parents and caregivers, teachers and students, regarding comprehensive sexuality education, but also to incorporate these views to adapt the CSE curriculum that's been developed by UNFPA and larger groups for implementation in the schools. And the questions they wanted to answer is, how is sexual development and well-being currently approached by stakeholders? According to those stakeholders, who is responsible for sexuality education and what are the respective roles of these stakeholders? Because there was a lot of ideas they thought were there, but they had no idea. And actually, it turned out they were very different. For example, it has to be the school health nurses. It's the ministry that should support it. While on the other hand, it turned out that the teachers were quite keen to be involved in it. And according to those stakeholders, what topics should be covered in the schools? So it's been an ongoing project. We also had a student go out to support the team. The student we had was quite good in qualitative research already, had a lot of experience in her past life before coming to Oxford in CSE, in Indonesia. So it turned out to be a real collaboration, and it's been a wonderful experience. The team is now doing the final analysis, and they want to write a report. And the other great thing is that through this project, they are really keen to start collaborating across ministries and are now working with colleagues in the Ministry of Education to bring them in. Some of them helped with data collection. And I think there is like a new kind of vibe that we can do this and we can help inform. Then the other example I would like to give is a project that was initiated just before COVID. On the invitation of the ministry, well, it's actually a collaboration between the National Public Health Institute in Liberia, Anfield, the Master Public Health Program in the University of Liberia, where we have one of our alumni from, I think it's the second cohort, which is done. And then also the government of Liberia. There was a proposal that was co-developed, and the idea was to do collaborative research to understand factors that contribute to the persistently high levels of maternal and neonatal mortality in this country. Of course, as you all know, this country has a long history of difficulties of civil unrest and Ebola and lots of other stuff. But we really wanted to collect data at different levels, like the central level in Monrovia, the health service providers in the county hospitals, but also go down to the communities and understand the perspective from that side. We wanted to examine, also together with students, and I'll come back to that, examine policies and program implementation, explore those various perspectives, but also use that to go and talk to those different levels, go back with the results of the research and see and try to find maybe small wins, small changes that could bring a difference. But at the same time also support the development of research capacity, because this, through all of our projects, is a very important thing. And the picture actually is taken during a data collection during COVID. And that was a little hurdle we had because of COVID. There were delays, but we managed to have a local team collect data at those various levels. So we had primary data collection in 2020. 51 key informant interviews were done, 9 FGTs, but then following up on that, we had 6 students in total, who some of them from Oxford collaborated with the team to do the research for the dissertation placement project and wrote dissertations. And in the last 2 years, we've had students going out there to really work with the team locally. So the first one was actually a systematic health policy review and resulted in a policy brief that's been presented to the government of Liberia. Then we had decolonizing data. It was a scoping policy review and a qualitative study that looked at data flows in the country and some of the difficulties there and the decision-making and the role of funders coming in and deciding on the agenda. We had one that looked at the determinants of seeking institutional delivery in Liberia, qualitative study, and then examining the current role of trained traditional midwives in MNH service provision in Liberia. Those were all based, was actually secondary analysis of the first round of data, but then in the last 2 years we've had 2 students, one focusing on supply chain and one on human resource issues that used the primary data and then added extra key IIs to the data and wrote their dissertation. So right now we are working on writing it up. deciding on which manuscripts, how to publish, and especially also disseminating it back to those 3 levels.
Thank you very much.
So good morning, I'm Bruno Holthoff. I did a PhD a long time ago, so I really empathize with the PhDs in this room, but I never pursued a traditional academic career, and it's actually the first time I'm joining this group, because I was a partner of McKinsey & Company in the global healthcare practice. I was chief executive of a healthcare system in Belgium, and more recently of the Oxford University hospitals. When I talk to some of you, you say, oh, that's the JR. Actually, it's a bit more than the JR. It's one of the sites. The trust runs about 40 other sites across the Thames Valley area. But after COVID, I decided to step down and increase my commitment to the IHTM program in terms of teaching, but also research. Now, co-supervising some of the master research projects, but also co-supervising DPhil students. My interest is in technology, especially how you can bring in technology in healthcare systems, which are quite complex, and look at how to make sure that they get adopted by the health professionals and accepted by the population or the specific patient groups that you're targeting with your technology. My past has been mostly in high-income countries, but my interest now has shifted towards lower resource settings, although I would say the NHS is a pretty low resource setting, having managed tight budgets over the past 8 years. So that's my passion. I'll give you a few examples of research. It's mostly focused using qualitative, quantitative methods and looking at acceptance of technology in specific settings, but also doing comparative cost analysis or cost-effective analysis. You have a couple of examples here. We're trying to publish these research projects as well. You can read these. I'll just, because you just heard about the Seychelles, we love the Seychelles. I'm not sure why, but we've done some work on their colorectal cancer screening program and found out that they're using the wrong technology. They're now trying to convince the government that they should switch the technology. So it's not just research for research purposes, it's also trying to have impact in the local health system.
We really just wanted to give you a flavor of the kinds of projects, and I won't go over the other research projects that we have for time reasons, but please do come to see our colleagues and ask us questions during the break times. Thank you very much.